We're going to start in another 2 minutes. So we'll be starting in few minutes, probably in a minute. Okay. Good evening, everyone. On a busy Saturday evening, this is Dr. Hemanth, and along with me is Dr. Vijay from the team of Doctor Tutorials, and we'll be guiding you and trying to orient you to the field of medical oncology with respect to the coming NEET SS and INISS program. The NEET SS and INISS this time is going to be a little bit of challenge, especially for residents who are preparing for medical oncology. The reason because in NEET SS you have what is called the medical group, and you need to answer questions of medicine with respect to all other fields in medicine, that includes cardiology, neurology, gastroenterology, oncology, and all others. So now this is going to be a common paper for residents from the background of medicine, from the background of radiation oncology as well. Now the question comes, what could be the percentage of questions of medical oncology included in this? At the other extreme, you have got the INISS. INISS, as we all know, has got two parts. One, the core subject, that's the medicine, and next, the specific specialty subject, that is medical oncology. The last INISS was something similar to what we had expected before, but however, the NEET SS for medical oncology was way tougher, way more challenging, way more discrete in the sense that the questions sometimes were kind of difficult to interpret and difficult to answer. And that was a common reply from all our residents who had appeared for the NEET SS last time. Going back to the format of a NEET SS, which includes medicine, probably into depth of medical oncology might not be asked. That is what we are looking at, because medical oncology is a vast subject. Unless and until you have probably worked or gone deep into the subject, it might be difficult to answer the questions of medical oncology. But that said, there are some core topics, there are some high yield topics, there are some topics of relevance which are quite simple, and every medicine graduate or any person who is going to attend the NEET SS should know. So going ahead, I have Vijay along with me here. So we'll be going through the schema of probably what is important in the field of solid tumors, what is important in the field of hematological malignancy, because that is also asked here, and then how probably to kind of prepare at the time when you have a little time, that is less than 3 months time, and if you have a lot to read to. So Vijay, handing over to you.
Hi students, today we will have a session in which we will be explaining as to how to get oriented to your medical oncology and the hematological malignancy part, mainly for your NEET SS. We will be also talking more for your INISS, in which we will be concentrating the depth of medical oncology as well. So going into the details. So we are expecting our exam on 30th of March, for which the questions are going to be really set, very discrete. We'll be covering most high yield topics both in medical oncology as well as in hematological malignancies. So what all questions can be expected, we'll be seeing that in the subsequent scenes. So we'll be seeing the solid tumors in the part 1. What are the high yield topics? Solid tumors. Very important.
Vijay, I think just a query. There is some lag in slide change, but I think you can proceed.
Yeah. High yield topics in your solid tumors. We'll be more concentrating on carcinoma unknown primary. There is a video on the same. Please go through the video. If any doubts, you can still contact us at any point of time. The other most important thing which we found it more difficult during this last NEET SS was the most important molecular oncology part. I think we will be covering up some videos on the same, and also explanations for the previous questions. And more important is case-based approaches, more so if it is an IHC-based approach when it comes to oncology part. And systemic oncology, more important for our INISS, more so to do with the important topics like your breast, lung, colorectal in your GI, renal cell carcinomas, testicular tumors, and some of head and neck and more gynecological malignancies. I think when it comes to INISS, statistics becomes more and more important. And when it comes to INISS, you get selected and go for the interview. They test you more on your statistics part, the cancer statistics and the details of it, the trials and the details of most of the trials. And for NEET SS as well, you can expect more questions on oncological emergencies, supportive care like your cancer-induced nausea, vomiting and its concepts on your hyponatremia, hypernatremia in relation to your cancer, and hypercalcemia. All these topics are more in oncological emergencies, which are also high yield for your NEET SS as well. Paraneoplastic syndromes, as we know, has been more important, involving almost all specialties. When it comes to oncology, it is becoming even more important. On drugs, we'll be sending some slides as well as concentrating on the most important drugs and the newer drugs as well. When it comes to the newer drugs, it becomes more important for your INISS. The drugs, its mechanism, most important side effects, and also its line of treatment with the combination of other agents along with this particular drug. So these are some high yield topics when you come read about your solid tumors. So when it comes to INISS, you are supposed to do your high yield topics with extra. What is this extra? These are the videos which we have covered up most of the topics. Along with that, we will be doing more on your molecular oncology as well. the latest research and its applications, which will be covering on the latest trials, its implications, and its current development in most of your important systemic malignancies. The newer drugs being approved in FDA and the upcoming drugs might also be more important when it comes to the INISS part. As we have already seen, molecular and targeted molecular therapy, molecular oncology as well, and targeted therapy is becoming more important when it comes to the INISS. When it comes to the NEET SS part, we will be concentrating more on the general oncology and most important systemic oncology only. So these things we can get to know from your grant test, which the elite test series, which we are going to write in 30th of March, wherein we will be covering the most important topics with more concentration on your high yield areas alone. So what to focus in this time constraint? More importantly, you have to decide on the books. We are trying to cover most of your Harrison and the hemat and oncology part of your Harrison, the hematological malignancies mainly. Be very sure on the tables, go through all the tables, whatever is being given by us, and whenever there is a free time to go through all the tables of Harrison as well. The flowcharts which will explain the whole concept in a nutshell, the images which will be explaining all those stuff, and also some clinical beginnings. Over to you, sir.
So yes, as Vijay discussed, you have certain topics which are kind of very pertinent even in the aspect when you are preparing for field of medicine. Carcinoma unknown primary, basic oncological emergencies like SVCO, tumor lysis syndrome. Repeatedly, every year there has been a question on tumor lysis syndrome. Not once the TLS has not been missed. Every year there has been a question on carcinoma unknown primary. So even when probably they will probably have to select a very few questions from medical oncology. These are some topics which are easy to understand, and in case you have understood it well, it is quite easy to answer as well. So compared to going into the depth of neurology or cardiology or gastroenterology, knowing some very basic but simple concepts in oncology rather than probably letting oncology go, I think this is not my subject and I do not have enough time to read, you will still get good amount of questions of oncology because there's a lot of overlap with every other system, say it gastroenterology, hematology, neurology, cardiology as well, nephrology especially. So there's a lot of overlap between oncology and these subjects. So knowing the basic core of those things are important. Now, what we are going to offer you in addition to the Elite Test series. So starting from 20th March, we are going to pick up high yield points from Harrison. That includes the drugs, discussion on tables and flowcharts, and some concepts made simple. And probably you have already seen the neurology and cardiology super learning bites, where in a minute you're going to kind of try to grasp the best out of a particular topic. So we are going to kind of come with one slide or one topic each day from 20th of March, so that by the end of next 2.5 months, you're pretty thorough with oncology. Next. So for INISS, I think I definitely would recommend seeing all videos. INISS has a very important focus on clinical approach. That is what previous our rank students, both 1, 2, 3, all the 3 rank students who have told specifically is the clinical approach, and the way we had discussed about every topic as a case-based approach. That is what was tested, and that helped them really a lot. So seeing all videos would probably be recommended for INISS. NEET SS, there are particular videos of oncology in the video section. Also, there are very important topics including carcinoma unknown primary, oncological emergencies, febrile neutropenia, and TLS. So for INISS, most residents would ask, should I read Devita? Now, frankly, no. Frankly, reading Devita is going to be difficult. The basic concepts are good in Devita. However, it is very difficult to absorb and reproduce in the exams. We've known residents who have tried reading Devita and later coming and telling us that this is a book probably Even during my DM, I would not read. Frankly telling, even during my DM, I have not read much of Devita. So going through Devita per se is going to be difficult, but there are something that you need to know. One, the videos, approach to case, most important being the immunohistochemistry, flow cytometry, and molecular oncology. Especially in the last INISS, we know that they went into depth of these topics. Cancer epidemiology and statistics, one question is definitely there. Epidemiology, you need to know what are the most common cancers in the world, what is the leading cause of cancer death in the world, most common cancers in Indians, and among male and among females, what are the most common cancers. You need to know these, the sequence at least, definitely. Newer treatment options, new drugs, their mechanism, the lines of treatment. Out of Devita, it is definitely going to help, and we are going to be there for you. Radiation oncology basics and mechanisms are again asked. And for interview, we had conducted mock sessions last time, and one of the residents had the same questions being discussed. We had discussed CML with her, and during her interview session, they discussed CML as well. So these are something that we are probably going to discuss for INISS. We also will be probably coming up with few short topic discussions specifically made for INISS apart from the NEET assess that will be coming soon in doc tutorials. Medicine. So we know that the NEET assess is going to be medicine. So that doesn't mean that out of the blue they're going to ask the questions. You have had the medicine part in INISS and previous NEET assess. Please go through the medicine part, because that is what is probably going to help. Every examiner, they might not pick up questions directly from the previous medicine papers, but all of the examiners will have a similar thought process that the student should be able to answer, and they will be picking up from those high yield topics which have been asked repeatedly in the previous years. INISS, as I already discussed, we have got these high yield questions. New pattern questions from hematological malignancy is also going to be there. We are going to discuss again on that. And concepts related to high yield topic, there's something called MSI. MSI has been particularly asked in INISS previously as well. MSI will be discussed, and we'll be going to probably put the slides as well. Vijay?
So when we talk of hematology, we will be concentrating on hematological malignancies alone. So where the topics which we'll be covering up and which are important in hematology are. So when it comes to hematology, each and every heading is going to be important for us. So this is more important for both NEET SS as well as your INISS. So when it comes to each and every part of your hematological malignancy, like AML, APML, ALL, and all those stuff, risk stratification of all these cancers, along with their translocations, the newer translocations, the resistant translocations, and the newer drugs are more important when it comes to INISS. When it comes to INISS, in-depth hematological malignancies and their discussions are going to be important. Transplant and transplant related questions are going to be important, mainly for those who are expecting to get through INISS. And transplant becomes even more important when you are going for the interview session as well. And when you are going to prepare for your INISS, very basic concepts on your flow cytometry, the minimal residual disease and its how do we calculate, or how do you process an MRD, how do you interpret an MRD, all these stuff are going to be asked more so in your interview sessions. The newer concepts like your CAR T cell therapy, though very basic concept, can be more important when it comes to INISS. The details of CML, its treatments, its translocations, the transcripts, and in depth about the newer drugs and the concepts of your CML. The same way, the scoring systems of all your leukemias and lymphomas, all these are very important when it comes to your INISS. When it comes to the NEET SS pattern, it will be more important to concentrate on your translocations, the risk stratification, and basic stuff behind these malignancies. More so, if it comes to like a concept called as hairy cell leukemia, and IHC on that can be more important both for your NEET SS as well as your INISS. Myeloma part becomes more important when you appear for your INISS. the in-depth about myeloma, we have our videos. Please go through the videos as well. When it comes to the lymphoma and its discussions, we have videos on that as well. Please go through that. The Hodgkin's lymphoma has been discussed in detail. All these detailed discussions are more important when you are trying to appear for your INISS. When it comes to oncology and hematological malignancies, in-depth is more important for your INISS. But for NEET SS, we will have to have an overview of all these topics, at least the ones which we know that is more high yield among these topics, like your translocations, the scoring systems, the organisms behind your something like your marginal zone lymphoma. These can be very factual questions which are important in your NEET essays as well. Just trying to remember these from all these questions and those videos which we are discussing, and also from the subsequent slides which we are trying to do from tomorrow, can be important for you when you try to prepare for your NEET essays as well. So same for MDS and transplant, more for your INISS. We have discussed these in detail in our videos, and also for our interview sessions. Once it comes to the students who are selected, we'll be doing in detail about all these in our mock sessions as well. So what are you expecting in your grand test? We'll be selecting questions which will involve all your high topics of your solid tumors and hematological malignancies. We'll be discussing about all our questions in the subsequent sessions in a detailed manner, which will be concentrating on the basic concepts, not just factual questions. So each question is going will be trying to answer a concept as well. Will be an overview of all your hematological and solid malignancies. And when you are trying to prepare for NEET SS, especially trying to concentrate on this grand test might give you most of the concepts which you need to take forward for your NEET SS. Also expect questions from statistics and molecular oncology. This is more important when you are trying to do for your INISS. When students are preparing for both, try to just go through all the questions for in the grand test, which we'll be discussing later also, so that we are able to cover in depth in some topics which will be more important for your INISS. We'll be giving equal weightage for your NEET as well as INISS when it comes to the NEET, more superficial and an overview of all your hematological and solid tumors. Over to you, sir.
So how to read again now? We have told you what is important. Follow Harrison, that is sufficient. In case you want to go ahead and try to know more, up to date is a good place, a simple place at times, where you can get the tables pretty easily. You can get the scoring systems related to anything on Google, and for everything else we are there. Any doubts, and call one of us or text one of us whenever possible. We'll reply and we'll get back, so that before going ahead, you have a clarity on the topic. Most importantly, the basics are extremely important, and that is what going to be asked. And anytime any suggestion and requirements from your side, most welcome, because that is what is going to help us design what you want. We have an idea of how probably the exam is going to be, but in case you have a demand on certain topics, we are always open to accept that and make content out of it. And that's it. We are going to close this session now. So I hope you have kind of now you know that what topics are probably important, and see you soon in the elite test, and we'll catch you again in the elite test discussion that happens after that. Good luck. Thank you. We'll open the session for a few minutes. In case anyone has any doubts, you can type in the YouTube chat. Okay, I think it's a good Saturday night. Everyone's waiting for the meal. we'll also probably catch you after the meal. So we are going to have our Facebook page. We are waiting for this session to kind of get active. So we are going to have the Facebook page, which is going to be active from now on. Also, the same topics will be discussed in the WhatsApp discussion groups. Make sure if you are a subscriber, contact the team so that you are included in the WhatsApp group, and make the best use of whatever you can get from us. Thank you.